Hi, in this video I'll be talking about my experience so far in my elective placement in oncology in the East Midlands. If you don't know who I am, my name is the Petrograd Nurse and I am a second year student at the University of Manchester and I'm also a blogger. So I started my placement this week on Monday, and the reason I chose this placement is because I had cancer myself 8 years ago, stage 2 thyroid, so I can understand like where the patient is coming from, like how they're feeling, and not just from a professional point of view but also a personal. I currently work at an oncology hospital in the northwest, which I'd like to work at when I graduate, but another reason is that I really want to know more about cancer itself and the treatment, like more about chemotherapy, etc. So for my first week, it was just like, just getting the feeling of the place, of the setting, of the ward, what I'll be doing with my mentor. I've actually got 3 mentors, which is quite helpful. Mentor first day, and I just did, observations. I actually didn't come across that much about chemotherapy, but then again, it is my first week. So I did I just did normal stuff really. So, I actually made beds, I washed down beds, I gave really good basic, just personal hygiene needs for patients. And to be honest with you, if you're going to be studying nursing and you think that that's not my job, then you're probably in the wrong profession, if I'm honest with you. And that is because, as nurses, we're here to, not just to give drugs or do the paperwork, we're actually here to help people, even in that way, even just giving them a wash, or it's just basic, basic standards of care, and that will make their day. So yeah, I washed patients, I did beds, but I also did jug rounds, and I also want to do a lot more jug rounds, because I want to know more about pharmacology rather than just giving someone a drug and not knowing what actually. But no, that was my first week, and for me it went quite well. And I think my goal for next week is to ask my mentor if I could take on my one patient myself, because I'm in the second year, and that's what I would like to be doing. That's the level I want to get up to, and build my confidence by doing that. So I really hope this video has been helpful for anyone out there who is going on the elective or wants to do nursing. So yes, see you guys soon.